Hello. There's been a lot of publicity lately about mental health, so I'd like to tell you my story about how my stay in ICU has affected my mind. It's a known fact that some medication can give people anxiety issues, and being in ICU I was put on a cocktail of drugs. Also, I was scared for my life and anxious about what was happening to me medically. I've recently done a little research and found a statistic that's nearly a quarter of ICU survivors suffer from post-traumatic stress disorder or PTSD. Additionally, patients that reported having frightening memories of the ICU have a higher risk of PTSD. I think this is because of flashbacks. Early on, after leaving ICU, I would have flashbacks to the frightening memories of ICU. Added to this the fact that I'd lost a leg and I was worried about my future, I had a lot to think about. The research also mentions that ICU diaries are helpful. The theory with ICU diaries is that nurses and visitors write in the diary anything about what is happening to the patient, so that later on the patient can understand exactly what happened to them. At the time, my hospital didn't keep an ICU diary, but this has recently changed. For my experience, I was very lucky that my mum keeps a diary, and about a year after I left ICU, I asked my mum if I could read it. It took me a while to be ready for this, but reading it has really helped. Also, recently I've asked for a copy of my medical records from the hospital. The two sources combined, along with conversations with my friends, mean that I've got a good picture of what happened. I think that without this, my mind would be trying to understand what really happened, and in my experience this leads to flashbacks, which can be very upsetting. One of the most scary things that happened to me in ICU was about 2 weeks after I was admitted. I had problems with my breathing, so the nurses put a plastic hood over my head. I think this was going to be filled with pressurised oxygen to help me to breathe, but combined with drugs and hallucinations, this turned into a terrifying experience. My parents were there with me and I was crying at them to call the police. The nurses said this was quite common, but I know that my parents were left upset with this experience. I have flashbacks to this as it seems to be too scary to be true. About a week later, my medical note said that I was neurologically much improved, but experiencing psychological issues, otherwise known as PTSD. A few days later, I told my parents that I couldn't sleep at night because of bad dreams and I was frightened of being alone. This they told to a senior nurse. I remember a couple of bad dreams. In one, a doctor was walking around the ward in the night and shouting and holding down patients who weren't asleep. In my dream, I could see this happening and I wanted to hide under the bedclothes. There was also a dream of the nurses teasing me and trying to get me out of bed and out of the room. Before my admission to hospital, I'd lost a friend who died in hospital. There was some history to this, and my brain was putting thoughts into my head that I would be neglected by the nurses. Soon after, my medical note said I had a psych liaison review. I was prescribed sleeping tablets. The next day, it was noted in my notes that my night terrors had improved, but I had anxiolysis, which is anxiety. For this, I was prescribed an antidepressant called sertraline. I certainly found lots in ICU and hospital to be anxious about. Being told what was about to happen to me by the nurses was necessary, but my anxiety levels would go up when I knew something painful or bad was about to happen. I stayed on sertraline for several months. When I was finally discharged, I started to wean myself off some of the drugs I was still on. I saw all the antidepressants and fairly early on I stopped them as I didn't understand why I was on them. A few months later, I was thinking about returning to work. I was having meetings with an occupational therapist and I mentioned to her about my flashbacks to ICU. She put me in touch with an NHS service called Time to Talk. I met with a lady from the service in my GP surgery. This didn't work for me. Firstly, there was an atmosphere of being in the surgery, and secondly, I didn't click with the lady I was seeing. She would just ask me questions and I'd answer them, and it didn't feel like a conversation. I didn't feel like I was putting any of my thoughts at ease. I told people that I felt more like it was a rant session where I would moan about my troubles. When I returned to work, I would feel upset very quickly for no reason. A few times in the office I would start to cry. I think I managed to get away without people noticing this. But one time I asked to speak to my manager. We went into a small meeting room and then I sobbed uncontrollably for a couple of minutes. It seemed like everything was wrong and it felt difficult to stop. And when I did stop, I wasn't sure what I was being upset about. Also, I had to leave the room with a very red eye, so people must have wondered what my manager said to me. Two things then happened. Firstly, I was looking into cutting down more on my medications, and I looked up one I was taking on Google. It was called gabapentin, and it's a painkiller, and it also helps with phantom pains after an operation. But Google said it can cause anxiety, and people were saying how it causes depression. I decided to cut down on this painkiller anyway, and I got it virtually down to nothing. But then the phantom pain started coming back, so I spoke to my GP and they gave me an alternative drug called Lyrica. I'm not sure if it's down to other things happening at the time, but I didn't feel as upset as I used to. Also at the same time I got in touch with a counsellor at the rehab centre where I visit for my prosthetic leg to be adjusted. This time I found the lady much better and I felt like we'd developed a better working relationship. So I think that the counselling is firstly about finding a person that you can relate to. It's good to talk to someone who isn't a friend who might judge you and not a family member who you might be afraid of upsetting. I'm not afraid to say that I see a counsellor. I think that coming out of what I've been through, you're going to have some issues. My counsellor was interested in my dreams from ICU, so it came in useful that I had them all written down. She had a book on dream analysis and I thought she'd have a field day when I left her my notes with her. It turned out that my dreams were mostly to do with guns, terrorists, explosions and trying to escape the ICU. I remember her saying that this was basically because I was powerless and immobile in the ICU and I wanted to escape. I still see my counsellor now. I think the flashbacks have improved and reduced intensity to just memories. I think more about the nurses and how they're trying to help me. My mind now is in a different place. The future of my remaining leg and my foot are uncertain. When I was in hospital, my right leg had to be amputated below the knee because of the damage done to my foot by the illness. But my left foot was in a better condition, but the future wasn't certain. So I had a discussion with my consultant and we decided to take the long journey of trying to keep the foot and the leg. Since then I've had bone infections, pain and setbacks, so I do still get anxious when I think that something is going wrong. As of today, I still don't know what is going to happen, so my anxiety currently is based around that. That's the end of my talk on PTSD. I just want to conclude by saying that it really does help to talk. I have some amazing friends and family. I know some of them have been through a lot too. When they came to visit me in hospital, I would have looked pretty horrific. I've seen photos of what I looked like then and I really appreciate how they still came to see me. Also, I really appreciate their continuing support and friendship.